I will now speak with Janetta Skarp, PhD student at the MRC Centre and GIDA on health systems resilience. Thank you for joining us. Can you explain about your research on health systems resilience?
Yes, so our aim was to map globally health system resilience with a particular focus on outbreak response. And doing so would help the global community decide or understand where to invest in preparedness globally.
What are the data sources that you use for your work?
So there's many data sources out there. Some countries have more data than others. So some countries have a lot of data on areas like pharmacies, the number of healthcare personnel, hospitals, and so on, but other countries do not have as much data available. Thankfully, the World Health Organization has developed the International Health Regulations Monitoring Framework, which contains 10 health system-related variables on many different areas of health systems. The 10 metrics cover varied topics such as the quality of a disease surveillance system, the quality of laboratories, and whether there are enough public health personnel. A summary IHR score for each country is created by taking the mean of the individual metrics for a given country. Each country is meant to report their IHR metrics to the WHO on a yearly basis, though this is not what happens in reality. As a result, we have missing data in the dataset.
How do you address missing data in your research?
So, all in all, there was about 47% missing data for 2010 to 2017, though there's less data as we move on with the years. And I used statistical analyses to combat this missing data, both the time series and the iterative principal component analyses methods. And through these analyses, I then managed to obtain a complete data set.
What are the key findings of your research?
So all in all, we have found that since 2010, health systems have been getting stronger, though there are areas that could still be strengthened. As of 2017, we can see particular clusters of areas with worse health systems, particularly in Central Africa, Eastern Europe, and the Middle East. If the novel coronavirus would enter these areas, they would probably not find out about the outbreak very quickly, resulting in a larger outbreak and more cases and higher morbidity due to disease.
How does understanding health systems resilience contribute to outbreak response?
If ultimately, over the globe, health systems would be stronger, outbreaks would be responded to quicker, which would result in a lower case count and also, therefore, lower morbidity due to disease. And also, if diseases would be treated at their source, they wouldn't be able to spread so far to other countries or territories.
Okay, thank you for speaking with us today.